It's tough because I was on the receiving end of this.
Healthcare workers are shedding light on, quote, worsening violence faced inside understaffed emergency departments, an issue recently detailed in the Canadian Medical Association Journal.
Nurses are physically abused. They are beaten. They are subject to sexual violence in their workplace. Uh, it has gone off the rails.
Up until last fall, Erin Aris worked in the emergency room at a Kitchener hospital. She says violence is a daily occurrence.
I had my hand broken. I've been clotheslined, beaten, spat upon. When I was visibly pregnant, I was pushed into a desk.
The Ontario Nurses Association says the violence has worsened during the pandemic, and the majority of incidents aren't reported or addressed.
This is just the tip of the iceberg. The reporting systems are not user-friendly.
Toronto St. Michael's Hospital has also seen the same increase in violence, aggressive behavior, and verbal abuse in emergency departments.
In the past, a lot of what we were dealing with in the emergency department was more predictable. And the hard part now is that we're seeing violence from certain patient demographics and patients that really weren't, predicted to be violent in the past.
St. Michael's Hospital recently developed an internal tool to identify patients who might be at higher risk of violence in the emergency department and use early interventions to assist those patients.
If they meet certain criteria, specifically if they're displaying signs of agitation, or whether they meet certain criteria on what is known as the violence assessment tool. The goal was to allow our staff to have an understanding of who might be more volatile, who might be more apt to assault us, verbally abuse us, and in that way start to implement strategies to reduce that risk.
The hospital says the tool has been effective, and they've also developed interventions they're hoping to roll out, at times with the help of community partners.
There's no precedent for this. No one has one single solution, and we're all really trying to work together to address this issue, which is really a nationwide problem.
ONA is calling for concrete actions from the province, saying staffing shortages need to be addressed. Ontario's Ministry of Health did not provide comment before today's deadline. For City News, I'm Faiza Amin.